Hi guys, I'm back with a new video that is writing important sentence structures in OET writing, which is very important and very common being asked in your exam. So I'm going to deal with it today. But in my previous video, I have mentioned many things about the OET writing and detailed part of the OET writing as well. Please try to take the maximum thing from my explanation, because many of the students, they are studying by themselves, as well as students, some of them are in the coaching center, but they are still not having the detailed idea of the format. If you are losing the format, I know that some of the format may have changed, but in my point of view, the change are not so big issues in my explanation, so that is not going to affect your letter writing. Especially in OET writing, letter writing, what I can tell you guys is that don't get so nervous that your letter is not coming so effective. The main thing is that there should be the politeness, and moreover there should be the formal standard. There should be some standard level, and if you are following those format, as well as if you are managing those information as per the needed, then there is nothing to worry at all to get the required score. So I'm going to teach you today again the new thing, sentence structures, which is very important in OET writing, which is very common as well. Please try to take the maximum things from my previous video. I like to say that again and again. And now I'm going to explain about these two common things, which is very common in your OET writing, and especially you are getting most of the time in your practice time, right? So you can take those ideas and I'm teaching these things because you can write those sentences without any thoughts as well as effort during your practice as well as during your examination. So I'm going to teach you today this, as well as some of the synonyms, which is very important to have in OET writing. So first thing is HB. HB means in a full, we can say hemoglobin, right? Hemoglobin, and then which is drop dash, again 3 packed unit of RBC is transfused. In that case, how you should write the sentence structures. These two sentence structures, as well as these synonyms, mostly come in the first body paragraph of the OET writing. First body paragraph, as I have mentioned in my previous video, it's also called the present medical history or first body paragraph. When we are mentioning the first body paragraph as well as the present medical history of the patient, we do the examination, we do evaluation, we do the assessment. These all are the synonyms, right? I have already explained in my previous video. So this evaluation, assessment, when you are mentioning that, you should make the sentence more beautiful by putting some of the sentence structures in between as well as beginning of the sentence, so you can make the more of your letter writing impressive to the examiner. So I'm going to teach you today this one. HB, dropped 3 packed unit. How you can write this on evaluation. Okay, you have done the examination or you have done the assessment, and then what you found is like you can mention his hemoglobin. If the gender is she, her hemoglobin was dropped, okay, and for which between that you should put the semicolon plus comma. That punctuation, you should not miss those punctuation, okay? I'm telling again, don't miss those punctuation, and then you can just continue for which there is a punctuation, 2 punctuation, semicolon with a comma, okay? Don't miss that. For which transfer, and then you can just copy paste. See clearly what all things you can copy paste, that you have to understand before jotting down these things, okay? And you should know what you need to fill it. On evaluation you should need to fill it, gender you need to fill it, and then this verb, and then for which, whether you need to write therefore or for which, you need to see the sentence structure carefully whether it is matching or not. So now second thing, please try to practice this in your letter writing. Second is a hypotensive, ramipril. This is a medication, reduce. Patient was hypotensive, therefore though he is taking ramipril, the dosage was reduced, okay? So that was the meaning. So in my letter writing, how I can mention or how I need to mention is, on assessment he was hypotensive, full stop, therefore comma. Okay, there is no semicolon. In case if you are writing in between the sentence, then there should be the semicolon. Since you are not continuing, instead you are putting the full stop, therefore comma, his remibral dose was reduced. Just the was, therefore what all gender, and then on assessment, and then gender, then just. It is very easy, right? So try to make that sentence in your regular practice so that you will not get hesitate, or you should not miss, or you should not be wasting your time during your exam as well as during your practice time. So I'm giving you these two sentence structures because I don't want all of the students to get stuck when you are getting such question, as well as many of the students are not able to make the better sentence like this way in their letter writing. So you are missing those points, you are missing the score as well. So try to take the better positive thing from my explanation. And now third thing I'm like to teach you about the synonyms. What are the synonyms here is, there are the synonyms many we are using in the assessment or the first body paragraph or the medical history. First is high values. If the values are high, how you can make a use of those words. Increase, synonyms, elevated, those all are synonyms. Raise, abnormal. Okay, on examination he had increased cholesterol level. Either you can use he had abnormal cholesterol level, you can say that. If there is no clear reading, okay, you can just say abnormal, it's also fine. Okay, but you can use the rest of them as well if that's your choice. And second thing is low value. If the values are low, how you decrease, reduce, dropped, you can see that clearly. You can choose any of them and try to practice that in your regular OET writing. On assessment, he had decreased hemoglobin level. Result, when the results are depicting in the assessment, he has done some of the investigation, you can say on investigation, on assessment, on examination, you can say any of the. That's your choice. On assessment, his MRI scan indicated the condition. Again, I will explain about the condition. The condition and the surgery when we are writing is when we have written already the diagnosis in the introduction. We are always writing the problems of the patient, right? If we have written the diagnosis in the introduction, either we have written the surgery name, appendectomy. Okay, if it is already written, no need to mention again in the next paragraph the surgery, appendectomy, no need to say that. Or pneumonia, no need to say that. Instead of that, we in the OET letter writing, we are using the condition, the surgery in our explanation. That makes the letter writing more impressive. So I'm using indicated the condition because it's already either mentioned in the introduction part or maybe in the beginning sentence. If the diagnosis or the surgery is already mentioned, you should not mention twice in your letter writing. Instead, the surgery or the condition should be written. So you can choose the sentence and try to use that in your practice. I have given the several of the example on assessment, his CT scan and X-ray showed normal result. Either some of the investigation, many are there, some of the patient they are getting the many investigations. In that case, you can use on assessment or series of investigation was done and it was revealed the normal result, or if it is abnormal, it was showing the abnormal result. Either you can explain with the vice versa, what was the normal result, which was the not normal result, you can mention. Okay, this is a way to tackle in the OET writing. Please try to take the synonyms and try to take the maximum synonyms here, and if you wish to take the sentence structure as well, you can choose. This is the tips for today, and thank you so much, and catch you in next videos.